Pocket Guide to a Smooth Delivery. This is your go-to cheat sheet covering everything from postpartum care to handling emergencies. Let's dive in. Postpartum power-ups. Fundal check. Soft equals massage time. Placenta delivery. Mom pushes during contractions. Nitrogen monoxide pulling the cord. Uterine atony alert. Massage vigorously. Watch vitals. Prep for fluids, blood D and C on standby. Lochia lowdown. Know your scans from your heavies. Infection signs, chills, fever, funky discharge, pelvic pain equals red flags. 2. Prenatal prep, ASTAT care. Na Jelly's rule, add 7 days, subtract 3 months, add a year equals BAM, due date. Morning sickness SOS, 5 to 6 mini meals a day. Urinary frequency fix, cajoles and sips, ankle swelling solution, elevate those legs. Heartburn help, don't lie down after eating. Anemia awareness, extra fluid, not iron deficiency. Toxoplasmosis tip, skip the unpasteurized milk, rubella reminder, vaccinate if the titers is 1 to 8. 3. Complication combat. Preeclampsia patrol, watch those respirations, urine protein should be trending down. Placenta previa protocol, inospeculum until confirmed. Check that FHR, abruptio alert, uterine hypertonicity is a key sign. Uterine rupture response, mom first. Hydatidiform mole mindset, watch for unusual uterine growth. Threatened abortion tactics, light bleed, closed cervix, cramps, soft uterus equals be vigilant. For labor and delivery domination. Hypotonic dysfunction, weak contractions, time to act. Precipitate labor, support. Cord prolapse crisis, Trendelenburg stat. FHR freakout. 174 BPM at 38 weeks equals red alert. Rome reality, check FHR immediately. Bleeding bonanza, bright red plus sudden wetness equals call the OB. Oxytocin oversight, check BP before, stop for tetanic contractions. Bleeding battles, pressure now. V, newborn nirvana. ENC essentials, dry, skin to skin, cord care, vitamin K, KMC know how, breathing steady. No apnea, snuggle time. Sucking secrets, comfort, closeness, pleasure. Teething timeline, central incisors first. Grunting equals danger, RDS suspicion, VE, procedure pointers. Leopold's lessons, palpate the fundus first. Amnio action, neural tube defect info. CST caution, watch for uteroplacental insufficiency. V, medication mastery. Mag sulfate toxicity, calcium gluconate to the rescue. Uterine atony, methogen or oxytocin. Turbulent tactic, check that heart rate first, 8 bonus bites. Calkin sign equals placental separation. Side lying equals best baby position. ROGAM equals 28 weeks, 72 hours post-delivery abortion. Hand washing equals 20 to 30 seconds. BSI equals body substance isolation. Cord clamping equals 2 centimeters from base. Mastitis equals fever, flu, tender nodes. Intrathecal equals spinal fluid drug delivery. Vitamin B6 equals glossitis treatment. Pulse pressure equals systolic, diastolic. Now, go rock that midwifery world. You've got this. Midwifery, key concepts and clinical scenarios. This document presents a series of multiple choice questions and scenarios relevant to midwifery practice. It covers essential topics such as postpartum assessment, prenatal care, complications of pregnancy, newborn care, and management of obstetric emergencies. Below is a summary of the main points addressed. I. Postpartum assessment and care, fundal assessment. A soft and spongy fundus postpartum requires gentle massage and observation for increased bleeding. Placental delivery. Appropriate actions include instructing the mother to push during uterine contractions, not pulling on the umbilical cord. Uterine atony. Fundal massage is performed by placing one hand above the symphysis pubis and gently but firmly massaging the fundus in a circular motion. Postpartum hemorrhage. Defined as bleeding of 500 milliliters or more after delivery, commonly caused by uterine atony, lacerations, hematomas, or retained placenta. Management includes vigorous fundal massage, monitoring vital signs and fundus, assessing blood loss, and preparing for 4 fluids, blood transfusions, or D&C. Endometritis. Suspect if the client presents with fever that began 3 days postpartum. Lochia. Understanding the different types of lochia is important for postpartum assessment. Postpartum infections. Signs include chills, anorexia, fever, malodorous vaginal discharge, and pelvic pain. Management includes monitoring vital signs, ensuring high calorie and protein intake, encouraging fluids and voiding, and administering antibiotics. 2. Prenatal care and education. Naegeli's rule. Used to calculate the estimated date of delivery by adding 7 days to the first day of the last menstrual period, subtracting 3 months, and adding 1 year. Morning sickness. Dietary measures include eating 5 to 6 small meals per day. Urinary frequency. Self-care includes performing Kegel exercises and sipping small amounts of fluids during the day. Ankle edema. Home care includes resting periodically with legs and hips elevated. Heartburn. Further instruction is needed if the client states, "I need to lie down after eating." Physiologic anemia of pregnancy, caused by the body producing extra fluid in the blood. Prevention of toxoplasmosis. Further instruction is needed if the client states, "I need to drink unpasteurized milk only." Rubella vaccine, given when the titers is lesser than 1 to 8. 3. Complications of pregnancy. Preeclampsia. Magnesium sulfate is used, and the primary healthcare provider should be contacted immediately if respirations are 10 breaths minute. Improvement is indicated if protein in the urine is trace. Placenta previa. Vaginal speculum examination should be deferred until the diagnosis is confirmed. Check fetal heart rate first. Abruptio placenta, expect to note uterine hypertonicity. Uterine rupture. After ensuring the client is stable, determine how the client perceived the event to provide psychological support. Hydatidiform mole. The midwife should be alert for unusual uterine enlargement. Threatened abortion. Suspect if there is light bleeding, a closed cervix, cramping, lower abdominal pain, and the uterus is softer than normal. 4. Labor and delivery. Hypotonic uterine dysfunction. Findings include contractions that weaken or stop during the active stage of labor. Precipitate labor, provide support to the mother. Umbilical cord prolapse. The immediate action is to adjust the bed to Trendelenburg's position. Fetal heart rate. If the FHR is 174 beats minute at 38 weeks gestation, notify the primary healthcare provider. Artificial rupture of membranes. Check the fetal heart rate immediately after. Vaginal bleeding in labor. If a client reports a sudden wet feeling with a large amount of bright red blood, notify the obstetrician immediately. Oxytocin administration. Prior to administration, it is important to check the blood pressure. Discontinue oxytocin if tetanic uterine contractions occur. Management for bleeding. Pressure is the best management. Newborn care. Essential newborn care. Includes drying the baby thoroughly immediately after birth and skin-to-skin contact. Care of the umbilicus includes cleansing with cooled, boiled water and leaving it uncovered. Vitamin K administration is necessary because newborns have no intestinal bacteria. Properly timed cord clamping is part of essential newborn care. Kangaroo mother care. Started when a newborn can breathe on their own and has no apneic episodes. Baby suck